Good morning. This is Dr. Dana Karam here. Today I'll be discussing about screening for different diseases and cancers. So there are a couple of things that I'll be talking about today. One, what is screening? Two, why do we screen for diseases and cancers? Three, why don't we screen for all diseases and all cancers? And finally, I'll discuss about some common diseases and cancers for which screening is recommended. So first, what is screening? So screening basically means to look for a disease or to look for a cancer when a person does not have any symptoms. So let's say you're a girl or you're a woman and you're feeling completely fine, but you go and see a doctor and you're over the age of 40 and your doctor recommends that you get screened for breast cancer. So you don't have any changes in your breast, you don't feel any mass or lump in your breast, you don't have any problems in your breast, but because of your age and your gender, the doctor is recommending that you get your breast screened for cancer. That is what screening is. So like taking a normal person who doesn't have any symptoms and looking for a disease or a cancer. So why do we do screening? To answer that, let me take the example of breast cancer again. So breast cancer usually starts as a small lump or mass in a woman's breast and then it slowly gets bigger. But when it's very small, most women don't recognize it, don't realize that they have it. And if they are not recognizing it, it keeps growing and growing. Usually like breast cancer starts in the breast, but when it keeps growing, then it spreads through the woman's blood to her lungs, her liver and her bones. So if she already has a mass in the breast, then you're going and doing some imaging of the breast or you're seeing a doctor for that. That is not screening because you already have a mass and now we are doing some tests to diagnose it. But let's say the woman is not feeling anything and then she goes and sees a doctor who does some images of her breast and now finds a small mass. That is something that we find from screening. So the advantage is we catch the cancer at a really early stage, at which time it is curable and the person can live a healthy long life. But if we leave it at that early stage and her cancer grows and spreads to other organs, we are not able to give a complete cure. Let's take another disease, for example, high blood pressure. High blood pressure is something that doesn't cause any symptoms, especially in the early stages. But uncontrolled blood pressure can lead to have it can affect your nerves, it can affect your vision, it can cause you to have a stroke. So if you're feeling well and you go and see a doctor, he notices that your blood pressure is a little bit on the higher side. He will talk about some diet and lifestyle changes that you can do to control your blood pressure and also keep an eye on your blood pressure. If it goes beyond a certain number or it's not getting controlled despite you following a good diet and exercise, he will start you on medications. He or she will start you on medications to control your blood pressure. So that's why we screen for high blood pressure even in people without any symptoms. Let's say we don't screen, you have really high blood pressure, uncontrolled, you don't have any symptoms, and finally you develop a stroke because you never knew you had high blood pressure and now you have a stroke, and when you're in the hospital for a stroke, they notice that you've been having high blood pressure. And we don't know how long you've been having it, but at least we know that it has come to a point that it has caused a stroke in you. So that's why we screen to detect cancers or other diseases in an early stage so we can act appropriately and prevent from getting complications. Third question was, why don't we then screen for every cancer and every disease in earth? So we only screen for those diseases and those cancers for which if we find at an early stage, we are able to make a difference, meaning like the doctors can treat and either prevent complication or prevent death. So only for those diseases we screen. And the second thing, the test should be reliable. Like we don't screen for ovarian cancer. That is because, so if you do some imaging of your stomach, it can still miss very early stages of ovarian ovarian cancer, and it's very some of the changes that we see in the ovary, we are not able to distinguish between normal changes in the ovary and cancer. So the tests should be very reliable. Like for example, for breast cancer, if you do mammogram, we can definitely diagnose breast cancer in most patients. So only for those kind of diseases and cancer for which we have a reliable test, we do screening. Third, the screening should be something that's affordable and make a difference if done. Like if the test is really expensive, then you can't put through normal people through that test and ask them to spend that much money to screen when they don't have symptoms. That's not feasible. So it should be a very reliable test. It should be like a cheap and affordable test, and it should also be like something, if found early, can change the life of a person or can change and protect him from getting complications or dying from it. Only for these diseases and cancers we screen. So finally, let me give some examples of some common diseases and cancer screening that is recommended for adult men and women. So first, for any man or woman who's over the age of 35 years, it is recommended that you get screened for high blood pressure or hypertension, especially if you're over the age of 35. If you have family history of high blood pressure, or if you're like overweight or obese, then we recommend starting little bit early, even around the age of 30. Just go once a year to a doctor to have your blood pressure checked, or that is something you can even do it at your home. Buy a proper blood pressure machine and definitely get your blood pressure checked at least once a year. The second disease for which we recommend screening is diabetes mellitus. Again, for diabetes, screening is recommended for anyone over the age of 45, both male and female. But again, if you have high blood pressure, high cholesterol, or if you're overweight, you have a very strong family history of diabetes in young age, then we start screening earlier, over the age of 35 again. The third thing we screen is high cholesterol or hyperlipidemia. Again, it is recommended that you get screened over the age of 35. So for screening for high cholesterol, your doctor will ask you to fast, meaning not eat anything for 12 hours, and they'll draw your blood in the early morning to check your cholesterol level. This is something you have to get done in a hospital or a lab, and then they calculate your cholesterol levels. So if your cholesterol levels are good, we just recommend screening every 5 years. But if you have some high cholesterol level, then your doctor might suggest you to screen every 1 to 3 years, depending on how bad it is. So these are three things, like high blood pressure, diabetes, and high cholesterol, for which screening is recommended over the age of 35, depending on your weight and your family history. What are some other disease for which screening is recommended is bone density. So osteoporosis is a very common disease, meaning like when the strength of your bones are like thin. So if your bones are thin, if you fall down, there is high probability that you will develop a fracture. So any woman over the age of 65, it is recommended that you get a bone density scan. It is actually not recommended in all men. It's unique in women because over 65, our estrogen, which is a hormone that keeps your bone stronger, starts going down. That's why it's recommended in women. But in men, if you have risk factors, like if you have been on steroid medication or other risk factors for bone loss, your doctors might recommend, especially if you're over the age of 60, to get screened with that bone density scan for osteoporosis. Especially all adult women and men are also recommended for getting screened for HIV, which is like AIDS, which is an infectious disease, and also for hepatitis C, especially if you were born between 1946 and 1966. These both are optional screening, especially if you're working in healthcare or you have risk factors of exposure to blood, needles, you work in a lab, then it is definitely recommended that you get screened for these infectious diseases to see if you have contracted that infection from somewhere. Other risk factors for this HIV and hepatitis C disease are like having sex with multiple people, having multiple partners, using IV drugs. Those are some risk factors through which you can get these diseases, and it's recommended that you get tested because these are treatable now. Again, if you have sex with multiple people or you have multiple partners, it's also recommended that you get screened for like syphilis, chlamydia, and gonorrhea. These are diseases that come from like having sex with multiple partners. If someone is infected, you can get that disease. So if you have those risk factors, it's recommended you get screened for these diseases as well, even though if you don't have any symptoms. Last but not the least, I'm going to talk about cancer screening. So for both men and women, there are actually two cancers for which screening is recommended. One is colon cancer. Everyone over the age of 50, it is recommended you get screened for colon cancer. 50 is again a number that is suggested for everyone, but if you have family history of colon cancer at a much earlier age, then they recommend that you start screening earlier as well. So how do you screen for colon cancer? There are actually three ways. One is your doctor can test for blood in your stool. That's called like the stool fit test. That is something that you do every year to get screened for colon cancer. The second thing is called Cologuard, in which your doctor tests for like a blood, the DNA in your stool, and again that is something that you can do every 3 years to get screened for colon cancer. Finally, it's the colonoscopy. A colonoscopy is basically a doctor uses a camera with a tube and goes through your anus to look at your intestines to look for colon cancer. So this screening is recommended for everyone, both men and women. The second cancer for which screening is recommended for both men and women is lung cancer, but it's only for smokers, especially people who smoke at least one pack a day for over 30 years or so. It is recommended they get screened for lung cancer, especially if they are over the age of 55. Finally, I'll talk about like the cancer screening in women. There are two cancers for which screening is recommended in women. That's the breast cancer, for which we use a mammogram to screen your breast. It is recommended for any women over the age of 40 that they get a mammogram at least every 1 or 2 years, depending on your risk factors. The second cancer is cervical cancer, for which we do what we call like a pap smear. A doctor gets like samples from your cervix to look under a microscope to look for cervical cancer, and this screening starts really early. It starts at the age of 21. From 21 to 30 years, you actually do the pap smear every 3 years. After 30 years, it goes to every 5 years because we can do additional viral DNA testing when you're over 30 years. So you do it every 5 years. So breast cancer screening is recommended till you're 74. Sometimes your doctor, if you're like really healthy, even at 74, they can continue even after that. Cervical cancer screening till you're 64. Again, based on your risk factors, they might continue longer. So for men, the one cancer that we screen for is prostate cancer. Previously, we were screening all men between the age of 55 and 74 with a blood test called prostate specific antigen or PSA and screening them for prostate cancer. Then with time, we realized that the test and going through the stress is actually far worse than diagnosing prostate cancer, which might not be a very significant thing in many people, meaning like many men might have prostate cancer but just live healthy with it and they die from other causes. And when they did autopsy on such men, they found they had prostate cancers but it didn't do anything to them. So considering this new information, we don't routinely screen for prostate cancer anymore, but if you definitely have risk factors of prostate cancer in your family, talk to your doctor to consider screening for prostate cancer. And as I said, it's just a blood test. Last but not the least, in men who are smokers, we also screen for abdominal aortic aneurysm when you're over the age of 65. So what this means is like we have a blood vessel called the aorta, which is like a major blood vessel in our body, and it carries blood to different organs. In smokers, this aorta starts slowly dilating and sometimes it can rupture and people can die from it. So in men who are smokers over the age of 65, it is recommended that they get this screening with a one-time ultrasound. If it's good, it's all good. If we find anything, then screening continues or appropriate next steps happen. So these are some common diseases and conditions for which screening is done. So screening might differ in different countries, and it can also differ, as I said, between men and women, and it also is age dependent. But nevertheless, screening is a really good thing because you're trying to catch diseases early and take care of it so it doesn't cause you complications. So definitely talk to your doctor about screening and try to get the age appropriate, sex appropriate screening and stay healthy. Definitely like and share this video and follow my page on Facebook. I also have a YouTube channel and an Instagram profile. You can follow me there as well. Knowledge is key to health. Thank you. Take care.